You're watching HCAM TV.
Good afternoon and welcome to the Hopkinton Hangout Hour. Thank you so much for joining us, whether it be on your comfy couch at home, watching us on TV, watching us on YouTube, or watching us on Facebook. We appreciate your being here. And if you're watching this on Thursday, the 16th, please feel free to contact us with any questions or comments you have because we're live. Joining us today is the Board of Health Department from Hopkinton. We have Shaun and Kasey, which we're very happy to welcome every Thursday because there is so much information coming out concerning coronavirus and opening and closing and what's happening. So we're very appreciative that they're able to give us some of their time, which is extremely valuable lately because they've been really deluged with needs. So we're going to get right. Oh, joining me also will be Tom Nappy, who will be co-hosting with me and passing along some questions from social media. All right, Shaun, Kasey, thanks so much for being here today.
Thank you for having us.
All right. So I would like to start off, if you don't mind, because I have a question.
Okay.
All I have been hearing for the past few days is the rate is going up and going up. Can you talk to us about that? What's happening?
So, actually, do you want to? I mean, you were studying this last night, Kasey. Do you want to?
Yeah. So, I actually was looking at. I can't remember the website right now, but maybe Shaun can send it to you if you can find it.
COVIDexitstrategy.org.
Yeah. And so basically there is this website that the state uses to determine the risk of each state. And so that's why with the travel ban now, like Rhode Island is included in that. And so there's a percent positivity rate for each state. Ours as of yesterday was 2.9. The state also reports on percent positivity for each town. So for the town of Hopkinton, we are less than 1%. Included on that website is also, it talks about like how quickly cases are being spread. So one thing that is concerning for Massachusetts is the increase in the amount of positive people. So like say last week or so, we were like in the 70s or less than 100 cases. And now we're up to like 200, 300, 400 cases a day. So the percent of the spread increase is about 70% for Massachusetts. So other states, that we're hearing about that are hot spots like Texas, Florida, California, they've actually have a lower spreading rate than us. Right now, the only two states that are red are Massachusetts and New Jersey. So we still have a good percent positivity rate where we're under 3%. If we go above that 3%, that's where we become one of those high risk states, even if but then we can still kind of gauge like our own risk in our own town by seeing like those percent positivity ratings for like Hopkinton in general. So like I said, Hopkinton's less than 1%, Southborough is 0%, Grafton's less than 1%. One of the highest towns around us right now is Ashland, so still close, but they're about 6%. So, there is still definitely stuff to be worried about, although in Hopkinton overall, we're doing well.
Why do we think this is happening?
I'd say, like, if you listen to the governor's daily conferences, he's identified, and the Department of Public Health has identified that, there are a series of cluster events that are driving some of this, and then it's people, as we're reopening, people are kind of relaxing their standards, and they're getting together in groups for, it might be a graduation get together, it might be a family picnic or family reunion type events or neighborhood events, block parties. They're kind of testing the system, and we have had a couple close calls where People have been at the beach, and in one case, we had someone who went to the beach and they bumped into someone who later turned positive. And it's these types of interactions as we get out and circulate more. You can in Hopkinton, you can certainly tell by the increase in traffic that people are moving more. We have people going to the beach, people going to the mountains, people going to lakes. So all of these different interactions, people going out to the restaurants, they're all generating individual risk. And at some point, as you're accumulating that risk, you're going to run into someone who's positive. And I firmly believe that it's just because people are interacting more frequently with others than they were, say, a month or two ago.
Yeah.
Okay. And where are you both right now? Are you concerned? Are you worried? What's your level of comfort here?
I mean, I think that if everyone stayed within Hopkinton and didn't leave and had limited but appropriate interactions with each other, like those types of things are still safe. But it's just making sure that people are on the same page, that that we are not, like, the COVID hasn't gone away. It's not going to go away. Like, as we decide about schools reopening and going into the fall, which we know has an increased level of just illness in general, like we're going to have to continue to be diligent. So I'm worried in the sense that I'm seeing the numbers rising. I'm not sure that people understand why or how it is. But I'm not super, I do know that we're capable of being careful as a community. I've seen it. We've all seen it. We know that we are capable of it. We just have to get back to it.
And again, it's one of the things that we've been discussing, and I've been discussing in our emergency management meetings and in my discussions with Dr. Kavanaugh. Yeah, a lot of this it starts, it starts at home. So I've sat down with my kids, and my kids have sat down with me. My 5-year-old reminds me that I need to limit the amount of trips I make to the grocery store. My 9-year-old called me out for going out to the hardware store, but they're right. I had taken some unnecessary trips, and I've scaled back now as our risk has gone up. But it takes that, me having those discussions with my wife and children, me making, my wife and I making sure that my kids are informed about social distancing and face covering, that they're comfortable with the face coverings that we have purchased for them, and that we're all well versed in the responsibilities that we carry, as members of our community. And when we've had a number of complaints about the basketball courts. So we've started sending municipal representatives up there to have discussions with the kids, because they were playing basketball without any face coverings. That's close contact. And we, as parents, we need to have these conversations with our children, just so that we're alert and we're preparing and we're acclimating, as we return to school, because it's going to be a significant shift, to some of the kids in the Hopkinton school system when they have to wear a face covering for 6-7 hours a day. And I think if we all kind of focus on reducing our risk and making sure that we are set up, each family is set up and prepared as we go into the fall and flu season, we'll come out of this okay. But it's going to take, the village to really buckle down, prepare, and if we do so and follow the guidance that we've been putting out, I think we'll be in good shape. But it's going to take that commitment.
Hi, Shaun and Kasey. This is one of the questions we got emailed.
I only got pieces of that, Tom.
Hang on a second, Tom. Start talking again.
All right. You guys hear me?
Good. You're as soon as you start talking, your audio is popping out.
That's strange.
I know. I give one more try.
All right, we'll try it now. Can you hear me? Okay.
Yep.
So have you gotten any word that the state is thinking about rolling back the reopening process with the increasing cases?
Do you know that I just got an email
Oh, wow.
asking me that very thing?
Breaking news.
No, it's like I just got a teachers group just emailed me because they heard that we might be rolling back to phase 2. There's been nothing that's been reported to us, but I know that the governor had been discussing rolling back the gathering limits, but that would be news to me that we're going back to phase 2.
I mean, we've all seen like the articles and like the Globe and stuff about the possible movement back to phase 2, but I think like from what we know, the increases in numbers isn't because like restaurants opened indoors. It's because of gathering limits. They just had sent out like a letter from Mary Lou Sutters, like just reminding people that there are gathering limits of 100 people for outside and 25 people indoors, and like basically to be able that you should not be hosting like graduation parties and stuff that's not smart, so it just was a reminder that like these large gatherings are the issue. Early on in March, when we had to get someone tested for COVID, we would maybe be able to get one person tested, and then we would just assume that the rest of their family was already positive, but we wouldn't be able to get 5 people tested in one household. Now, if one person has it, their whole household gets tested, and everyone that they had contact with gets tested. So we know a lot more because we're able to test those people, but now we know you get all these numbers that before we just assumed that these people would be positive instead of actually having like a confirmed number. And then I don't know. We haven't really heard like if like the stop the spread testing has any impact on like the percent positivity. So, we're having these testing events in areas with high amounts of transmission. Some of them have like 20% transmission rates. And so when you're testing that community, like of course you're going to get a high rate positivity, especially if people are not abiding by like gathering limits, and they're just overall not complying with like public health guidance. So I mean, I think that it's more that like I think it has something to do with like the stop the spread, but that doesn't mean that those cases still aren't there. They're still there, so it's still the rest of us.
Yeah, it's great. Yeah, go ahead.
Oh, sorry. As far as Hopkinton's concerned, talking about those social gatherings, is there anyone looking for those social gatherings to perhaps have a word with people that may be hosting them or taking part in them?
There's a new website where you can provide notification to the state, and then it comes back down to the health department. So there is a new tool for residents to help police it. But, this gets to the point of, we're so I can't say like overwhelmed. We're so inundated with responsibilities these days on top of what we normally would be doing day to day, that to then assume that, that we're going to go and patrol the community, it's just unrealistic. And then there's this interesting distinction where if you actually hire a caterer or a clown or someone like to your back door or backyard event, then it becomes an event, and then we have limited jurisdiction. But otherwise, it's more of It's more of our ability to make recommendations, and then does that large gathering constitute other nuisance issues like for noise and whatever. But so to answer your question, no. I mean, I'm not getting out in my car and driving around policing it.
I mean, I do feel like for the few people that have either wanted to have like a gathering on a larger scale, have asked us for instructions on how to do so, looked at the state website and, tried to read the guidance and then asked for some clarification. So, I mean, it's in your own best interest if you're going to host an event that you do it safely. But I feel like the majority of people have asked for help on how to have a safe event. And that whether there's an event that happened that we know about or don't know about it, like they at least did it safely up until today because we haven't had any cluster events. So we at least know that much.
Right.
So we haven't had any cluster events in Hopkinton.
Not since like the surge, so
Yeah.
we like big cluster events since the surge.
And our cases have gone up recently.
Right.
Is there a sense on where that's happening?
We have 3 active cases. One is not a cluster event, but is from a group home. One is like a work related, and the other one was contact.
Yeah.
Oh, okay. So, by the way, we had a question from Kim asking if you could tell us the age group of current cases in town.
I think that overall, one of the things that is surprising, at least to me, is that most of the cases are like adults. And when I say adults, I mean like 40s, 50s. We have a big, obviously, population of people that were positive in March that were, 60s, 70s, 80s, 90s. We don't really have that right now. The majority of our positive cases fall somewhere between like 37 and 60. We're not seeing less than 18-year-olds. We're not really seeing college age students. We were seeing that in March, people coming back from either spring break or coming back from studying abroad. We were seeing that age group then, but we're really not seeing that group now. And even when we did see a couple of the pediatric cases, they were few and far between, less than 5.
And then even with what I call our probable cases, we don't know when they contracted. So we don't know when they contracted the illness, but that there's a trend in that group towards a younger age. I think we had said it was in the 30s or 40s.
I think it's 38, but a majority of our probable cases. So probable is 2 categories. It's either means that you had an antibody test that was positive or you've had an antigen test that was positive. Antibodies means you had it for 10 to 14 days or longer ago. Antigen test is like PCR, but not as sensitive. And the majority of our probable cases are antibody cases. So that's where like a lot of that number gets pulled down. Those are a lot of like college age students returning from school that were sick in March, that kind of group.
I was wondering, when we talk about testing, there's been a lot in the news about, the accuracy is about 50%. You've been reading in the news that testing has been going down and testing has been taking too long to get back to be useful. How is our system here in Hopkinton working?
So Massachusetts in general is trying to transition. Do you want to talk, Shaun?
I was just going to say that, the governor is committed to moving all of the testing or making all of the testing internal to Massachusetts so that we are not influenced by what's going on outside of the Commonwealth. So his efforts have been successful where we, back in, say, March and April, where we were relying on companies like Quest and LabCorp for up to 2/3 of our testing. we're now relying on that. They're probably doing less than a third of the work in the state. So if you go to a testing facility and they send your tests to one of these large nationwide laboratories, you should expect to get a 10 to 14 day turnaround. However, if you're using a resource that's based in Massachusetts, then most of those labs are still turning around PCR tests, which are the gold standard, in 2 to 3 days.
One of the things that I've been thinking about was also a question that was emailed in. There's been some states that are already back to school, and some are having a few problems, and students and some teachers are under quarantine. Is there any, and the question from the email, is there any specific talk that our state will be watching to see what happens in states where school's in session right now?
I think that it's important to look at, like, when you look at percent positivity rates, so for like some of those states, like you look at Georgia, their percent positivity rates for their states are like, I don't know, 10, 8, 9, 10, 11, 12% positivity. So that is like sending kids back to school when there's already known community spread, when the percent positivity is that high. So, if our percent positivity increases, it's something that the state should consider not reopening us, because as that number increases, it means there's more community spread. So I read an article where they started school and a kid had tested positive on the first day. It's like, well, first of all, that kid should have never been there at school, because if they had a low enough percent positivity rate and were doing health attestations for the child to go to school, and the child shouldn't have been there, because if you're being tested, or if you've traveled, or if you've had exposure, or if somebody in your house has exposure, if you have any symptoms, like, you're not supposed to be at school. So I don't know how that child got there, because it's not that he got COVID that morning and then tested positive that night. You have to have it for at least 48 hours. Right. So he got it before school started and then brought it in. So if you don't do that, you don't have community spread, like, then we're not in the same boat. They're not comparable. But if you have community spread, our percent positivity rate is high, and we don't ask any questions about screening kids before they go into a building. Like, certainly you should expect to have the same problems.
Right. And that,
okay.
One of the key things I was going to add is that, again, this gets back to, it's imperative that our parents are having these conversations daily, with their kids, because if we're not checking illness at the door, like if we're not preventing illness from getting outside of the home, then we're allowing that potential to spread within the community, amongst their friends. And then when we get back into school, there's a greater risk of, introducing something to the school. So it's imperative that we not send sick kids to school. It's imperative that we stay home if we're sick. It's imperative to realize that if my child might be sick, I might actually have something, and it hasn't presented yet. So again, we have a huge responsibility to manage our health at home. And if we're doing that, we should see a dramatic, decrease in illness in the community. We shouldn't have as much cold or flu or respiratory illness, which is just going to confound the whole problem as we look to reopen. And so again, it's going to take a lot of responsibility, in and amongst our households to control this.
Since March, so it's like we spent all this time educating people on the important things, first of all, symptoms of COVID, so you can recognize it, and then also things that you can do to prevent the transition of COVID. And we're getting to the point now where You all know what it is. You all know what you have to do. Like now you need to, instead of just being educated and knowing the right answer, like you need to be able to apply it in like a real life way, without somebody always telling you like, make sure you wear your mask. Like it should just become second nature, and it just has to be a whole culture change.
Now, I know it's the hope that people will do the right things at home and making sure that they're not sending their kids to school sick, or kids aren't deciding to go to school sick. But is there going to be any type of monitoring when schools reopen and kids are able to come back? Is there going to be monitoring of the people walking in the door to make sure that they at least look healthy as they're walking in?
Yeah, I mean, that is part of the DESE plan, for there to be a visual assessment from the staff, like on the children. I do think that it's important that it first, like Shaun was said, it starts at home. Like the parents need to be in tune with their kids. The kids need to be honest with their parents before they go. But, obviously visual assessments are going to be part of it. Everyone, if schools reopen, like everyone's going to be so nervous. They're going to report the first kid with a runny nose they see. I don't think anyone will be not willing to do that.
Okay. Now, at this point, we do have a second co-host, Bob Hamilton, who's been monitoring YouTube for us, and I believe a question or a comment has come in from there.
That's right, Jim. I have a comment from John Ritz. And this goes back to the gathering question. He understands that you can't drive around and look for gatherings, but he notes that the HCA has outdoor concerts Friday and Saturday. Farmers market is on the common each Sunday, and the high school graduation was last Sunday.
Right.
Maybe you can do spot checks.
Well, like I can speak to the graduation was like I didn't issue a permit, but it was a permissible event. There was a guideline given for high school graduations. We had lengthy discussions with the principals, Dr. Kavanaugh, and we put together a plan that we knew we could execute on. And everything that I've heard reports that they executed very well with that ceremony. The farmers market is an essential business that is it's permitted by the governor's group to be operating. And again, they had several meetings with us. They met with my board. We put together a plan. There's a unidirectional flow through the event, and they manage the crowd numbers. So like we're managing all of this, and those are all permitted events. And then
the HCA is the same thing. So the HCA, I've been working with them. They, told me about their outdoor events before they hosted them, probably, 6 weeks now at this point. We made plans for them in order for them to host them safely according to the guidelines. A lot of us just spent so much time being isolated and not being able to see anybody. So it feels really weird when people are interacting with one another. Some types of gatherings can be safe as long as they follow guidelines, and the ones that this person mentioned, like, have all been guided by us using the guidance, and they've been following it without any cluster issues.
Okay. Kasey, I'd like to go back to something that you were talking about, because I found it very interesting. You were giving the example of the child that went to school, and that day, first day, was tested positive, and they had to have had the virus for, I think it's 24 to 48 hours before that would show up. Now, it's my understanding that I haven't had COVID, but it's my understanding that it can take up to 2 weeks to get symptoms. So there is kind of like a lag there, and I'm wondering what your thoughts are on the importance of that, or if there are ways to mitigate that, or if it comes out in the wash.
So I mean, say if somebody gets COVID, right? They don't technically get it. There's an incubation period of 2 to 14 days. So you can get it as early as 2, you can get it as late as day 14. You test positive somewhere in that realm. if we were doing like contact tracing on that case, we would look 48 hours before that kid tested positive. So actually anybody that he had contact with 2 days before school started or 2 days before symptoms started is when we would start contacting the people that he was actually with. And then like depending on school reopening, so say if this child is in school and they are symptomatic and they test positive, anyone that's a close contact, which is 15 minutes less than 6 feet, is considered a contact of that case. And then from there, you would have them quarantine at home. Quarantine means you're waiting to get sick. So you quarantine at home, you try to limit your interaction. The majority of people experience symptoms or peak on day 5. So it is a good idea that if you're going to get tested, that you get tested around day 5. Or if you have symptoms, you could get tested before that. Just because you get a negative test result doesn't mean you're out of quarantine, because you could potentially still get the virus later. So, you're supposed to be quarantined for those full 14 days, which is just, it's a little bit conflicting, especially now, like you have to use a little bit of judgment. People are wearing masks, they're not wearing masks, their interaction was 6 feet apart, but it was maybe 8 minutes. Like, what does that mean? Like, there's a lot of things that play into deciding for who's a close contact, who needs to be tested, how many times they're tested, when they're tested, what does that mean, what tests did they use. Like, it requires a personal conversation with that person for about an hour to like get it all sorted out. There's so many fine details to it.
So, talking about the schools, I don't know. I know that you both have children. Do you both have school-age children?
Yes.
Yeah.
Okay. Now I know in our world, we make decisions that are best for our family. However, nobody is more steeped in knowledge concerning this than the both of you. So if you were comfortable sharing, I'd be interested to know what your plans are for your school-age children.
Should I start with how polar opposite my situation is?
Sure.
Okay.
So, so my 2 children go to a Catholic school in Boston, and they're going back full time, full class. So, but what we did as a community is from back in, I want to say June, all the physicians whose kids are part of the program, the first responders, the teachers, the teaching administrators, who all have kids at the school, the public health people like myself, my wife, who's part of BU's opening, we all got together, and the parents, the teachers, and the administration all worked together to put together a set of scenarios where we thought that we could manage manage our risk. And we have a effectively an attestation type program. We have a very rigid, like if I sent my kid to school, I sent my kid tired once to school and heard about it for a week. So we have a very strict community understanding as to what our responsibilities are to ensure safety in school, and working from the DESE plan, the CDC's plans, and then best practices coming out of hospitals like Brigham and Women's, Beth Israel, Deaconess. We put together a plan that we feel that we can execute on, and we have much smaller classroom sizes, which allow us to easily get the 6 feet of separation. But we have full masks. We have our mask breaks will be outside. We're doing everything we can do to control our cohorts. Like I'm not allowed in the building, but that's because I'm coming from outside the classroom community, and so we've really created a very what we believe is a well-controlled system, and then we'll see how we execute. And then this is something that will be a model that gets scrutinized. It's part of the Boston College laboratory program, so I'm sure their educational and health groups will be focusing and monitoring this. And but I'm quite confident that we can execute on it safely, and I'm comfortable sending my kids.
All right. Now, Kasey, we're going to get to you in a second. I just have to ask Shaun one thing. Because since you go to a Catholic school, I was reading about that. Full-time, all the time, back to school. When I was talking to Carol about Hopkinton and our plans, I said, could this ever change based on stuff coming out? And her answer was, in any instant. I'm just wondering, does the Catholic system, is it done, or are they still monitoring?
Oh no, we're still monitoring. If we fell back to phase 2, that could change. And we have a whole virtual program already set up. So just like the public school system, we have 2 scenarios set up, and my understanding is that the hybrid just isn't a consideration at this point.
Okay, thank you. And Kasey, if you're comfortable sharing, I'm interested in what your thoughts are.
Can I just say, I'd imagine that school is very happy to have a health director on board, helping advise what they're going to do.
We have
Yes.
2 infection control directors, 2 ER doctors. It is it's a well-rounded group. A bunch of people from the Boston Public Schools whose kids are in our program. It's a good group, but we have the same type of professionals here consulting with Dr. Kavanaugh. So, like I'd say, both scenarios we have, we have well-respected professionals consulting with our school groups to put together a plan that they believe is the safest and most easily executable. So
okay,
said.
Kasey.
I don't know if I'm allowed to answer because my kids go to Hopkinton. So I don't know if I'm allowed to answer.
Okay.
I do think that Hopkinton has like the schools have like done a great job, reorganizing like the reopening committee and trying to consider all issues that might involve the schools. I still think that there's so much planning to be done because even though in Hopkinton, like we know where our goal is to get to like a hybrid model, like other towns still don't know like what they're doing. So there's still just so much more to know about school reopening. And then like as the public health nurse in Hopkinton, like there's some things that like I'm looking for that outside of like being a mother that I'm looking for like as a nurse that I think we'll get to. I really think that we have really strong community and like employees in town, and I think everyone's really committed to the health and safety of students and faculty. So I feel like we will definitely have a solid plan in place, but I just feel like it's not final. We still are learning so much.
Right. Okay. Thank you for that.
Yeah.
I was going to say, just like one of the luxuries that we have is that our kids, we drive our kids to school, so there's no busing. We have very strict control of our cohorts. So, and then we don't have like we don't go beyond what, 8th grade. So again, it's a very different situation that I'm dealing with there. But we're using those experiences, and like I said, and like Kasey said, we've done a good job at working together to put together a plan, and now they're just ironing out the details. As we start moving towards opening day.
As far as schools reopening, I know there's a great plan in place. Is there any set in stone date to when that will be finalized, or is it really just wait and see right up till the school year?
I mean,
I think it's probably wait and see, because they say if for some reason, like if we say, okay, it's set in stone, August 16th, and then on August 17th, like our percent positivity rate goes to 14, like obviously that doesn't matter anymore. Like that plan shouldn't just forge ahead because it was set in stone. Like, we're really going to have to be flexible and look at the health metrics and decide like, where we are on a risk scale and if it's appropriate to have such a large gathering, the largest one that we would have had in the state.
And I would say that is actually the plan.
Yeah.
It's not as though like the plan is we go in hybrid and then if we have to change plans, it's like, no, you've always talked and Carol has always talked that you guys are monitoring the situation, and if certain things happen, it is part of the plan that
Right.
responses will then go from there.
Right. And I was just checking. We haven't got or received any updates from the DPH or the governor's task force, and I don't see anything popping up in the news. So, all as Dr. Kavanaugh said, as the governor said, we're looking at the data, and all decisions we made based on different sets of data, different data points.
So could I just kind of loop back, because I thought this was really, really good knowledge to have. The numbers in Massachusetts have been going up recently, but from your knowledge, a lot of that is known situations where people have been congregating and they for some reason weren't doing it right. And that's where most of this change is coming from, not just the fact that, there are more places open and people going everywhere.
No, I think it's like, it's not like a definite answer. It's not like they come out and say like, okay, of the 3%, of the 2.9% positivity, like this percent comes from that. But, where they made the announcement last week about a reminder about the social gatherings and the sizes, I think that should be a cue to people. And they also made the reminder to people, about not traveling to high transmission areas by, creating the travel ban. Like they're trying to tell you without telling you, like we're getting it because you're traveling to another state with high risk and bringing it back, and then your whole family's getting it. So that adds 5 people. Or if you're having a gathering of 100 people and 80 people test positive, like, like that's where our issue is. I don't think that it's restaurants and all this other stuff. And though I don't believe those are the issues. Our issues appear to be people coming from areas of high transmission and bringing in, creating clusters or these large gatherings.
Right. I mean, I've had a few discussions with the director in Framingham and some of the other communities around here, and their story is similar. It's we expect a certain level of illness coming in because we have a significant number of medical professionals living in the community. We're seeing people that are traveled out of state or out of country return with it, and then there's this kids, just people coming. We've had instances. I think there was just a case down on the South Shore where they were running a football practice that they shouldn't have been, and there were multiple kids at the practice that ended up turning out positive, but they were participating in an event or in an exercise where they're piling up on each other. There's no masks, there's no distancing, they're spitting and grunting and whatever. That's just that's a poor choice, as my 5-year-old would say. And given the circumstance, we need to make sure that we're making good, sound decisions. Because at the end of the day, there's a pandemic. It hasn't gone away, and this is what drives. I would argue that it drives us crazy. Is that the pandemic hasn't gone anywhere. We're just doing a good job at controlling it. So, if oh look, there's someone with a knife outside our door. Should I let him in? We all know the horror movie. No, don't get up from the couch. Don't. I'm like, we've all seen the movie, and we're just living it now. So let's just kind of buckle down and make sure the door is locked, the windows are shut. And if you get that creepy call on the phone, you call the police. There was someone with a white mask outside. But this is what absolutely drives me nuts. Is that I'm like, I shouldn't be fighting with you about the drug, this potential drug that's on the market. Just wear a mask and distance, and you don't have to worry about taking the drug. It's that simple.
Right. Now I know Tom's got something to interject, but I just wanted to say that it's my hope that I can totally understand, right? We've been doing this for months. Everybody's sick of it. The weather is awesome outside. The guidance from the state is we're going to a new phase. This is great. Now we have an opportunity to say, oh, look at this. We actually still really do need to pay attention to this and do the right things that we're supposed to do. That's my hope. Instead of being some of these states where it's like, oh, we're just going to keep going with it. It's going to be fine.
Yeah. I mean, I think we at least learned our lesson early on, that we need to scale back, so I don't think we'll get the other states where community spread is so prevalent that you don't even know where it starts, where it began, or who to even track. You can't do effective contact tracing when you have that much community spread. So I don't think we will get back to there. So I do think that will be okay.
Well, I do. I do want to say that football practice that Shaun mentioned, they did have masks, but unfortunately, the mask of a football helmet isn't really good against viruses.
Right. But it's we've been learning about it's just people are taking liberty, or they're stretching. They're trying to stretch or getting around the rules. I mean, there are multiple. It's been brought to our attention that there are multiple sporting tournaments going on around the Commonwealth, and tournaments aren't allowed unless you're a level one, sport. But bringing together 40 sports teams, with 8 of those teams being from outside the Commonwealth, and having 200 or 300, 400 people in a parking lot, it just doesn't make sense, given that we're in a pandemic. You want to limit your exposure to people. And again, it's my 5. I keep on going back to my 5-year-old. I mean, she's like, we got to make good decisions. And I'm gonna step away for a few days, and I'm going to locations where, I'm not going to the popular place where I see that there are only 20 slots out of 200 available, to go on a hiking trail. I'm going to go to the one that has 140 openings. I'm not taking I go up to Mount Washington, I'm not going to take the cog rail up. I'm going to drive up in my car. It's I'm doing everything I can to control my risk while getting out there and introducing my kids to, nature and just trying to get them outside. But I'm doing it, cautiously and in factoring in, the risk that's involved. We won't be dining inside. It'll be takeout, outdoor dining, but probably outdoor dining in a field as opposed to,
Those are all good things to practice. I mean, my kids haven't seen the inside of a store since March. Like,
right.
they're probably going to go into shock when they get to see Target for the first time. So I mean, like, that's part of, like, when we go back to school, like, kids have to remember what it feels like to be able to do stuff. So it's important to take your kids out and do hikes and make them practice wearing their masks and, like, kind of seeing, like, what the new norm is. So it's important to do those things, especially if you're planning on sending them out to school or whatever the plans are for fall. It's important to start getting out there a little bit, but safely.
And I was just curious, you were talking about high risk areas earlier. Does the health department have any role in monitoring people that have traveled to high risk areas or that are come back from them at all? Do you guys play any role in that?
Yeah, it's where I'm supposed to receive word tomorrow that I have access to the database, and I will. So when you're on an airplane, so if you can picture traveling to Europe, you get your custom slips. You got to fill out the custom slips, declare, then you go through customs. You pass your papers forward. The customs office has the papers as you go through customs. They review everything. That's what the governor's system has basically been set up like. If you're on the airplane, if you're on a bus, you'll be or train, you will fill out a form digitally. That form gets, I believe, sent to the contact tracing group. They send out the information to the individual towns. They have specific email addresses at each town. Like in Hopkinton's case, it'll come to Kasey and I. We'll be able to log in on a daily basis. We'll be able to print off a list of the addresses where people are supposed to be, quarantining after travel. And so it's this checks and balances system. We have the authority through the governor's office to fine people for not complying. I have my ticket book. I'd prefer not to have to use it, but there's a system in place. It, as reported, it hasn't been really active this first week, but it's supposed to go into full gear next week.
So if you see like a Rhode Island license plate or something like that, will you maybe try to track that or something like that?
I'd rather not.
It just like everything else, it requires you to have like some to be a good person, to give yourself up, to say like I traveled. It requires you to do that. You have to like agree to fill out this form. It's not like the cops are going to stop you when you go over the Massachusetts line. Like it's just in your best interest to follow the rule, but nobody's going to pull you over if you have a different license plate.
Right. And the reality is, we have a significant number of people from Rhode Island that work in Hopkinton, and we have a significant number of people in Hopkinton that work in Rhode Island. And so it's not set up that way. And then all of those individuals are exempted. But if you're, again, this gets back to making wise decisions. Should I go grocery shopping in Hopkinton, or should I make a drive down to Rhode Island to go grocery shopping? Right now, with them in their risk at their current positivity level, it's not a good decision to go there. So again, this gets to us, and I know a lot of people are suffering from decision fatigue, but this is an important decision and consideration to make. When we're looking at, is that a necessary trip? I want to go out for a burger. Do I go to Worcester? Do I go to Rhode Island? Or do I stay, in the Hopkinton area? You've got to make sound decisions, and it's going to take a little effort. But at the end of the day, if we're all practicing, and making good decisions, our community health is going to be better, and then we're going to be afforded, the luxury of having a healthier community. We'll be able to do more things. Our kids won't be, sent home from school, and we'll have some more continuity in our work lives. There's a lot of reward to be had by doing the right thing, and that's all these everybody that's complaining about masks and distancing. We're only going to be suffering through this more if we're not compliant, and that's the other thing that drives me nuts is if we would all just buckle down as a country and do these simple things, would be in a much better place, and we wouldn't be complaining about, oh my God, we might have to suffer through a second lockdown. And but it's all up to us at the end of the day. I'm doing my part. I know Kasey's doing her part. Kasey makes sure I'm doing my part. I don't necessarily have to follow up on Kasey as much. We keep the chief in check, but that's what makes the fire department safer for everybody. So we all just need to do our part.
I agree. When I talk to people, and I understand the fatigue, the physical distancing fatigue, and all the tired and things, but I always come down to, you know what? This is not World War II. Right. This is not like going to go on for 6 years, and everybody's really suffering. We're talking about putting a piece of cloth on your face and not, congregating in large groups and stuff like that. We can definitely do that. And what I find very encouraging for us, maybe not so much for the rest of the country at this point, is that we had it tough at the beginning, and we showed that we can affect this. And there are other states who are showing what happens if you don't do the simple things that you need to do. So, I mean, we've got an example of success, and we have examples where they haven't had a lot of success.
You look at New York. New York hasn't had a death.
The lowest percent positivity rate of all the states. It's like exactly 1%.
Wow. All right. Now, we really, really do appreciate your time. Thank you for coming out so much. I wish that you guys, got hazard pay, because I can't even imagine all the calls and all the emails and everything that you have to do, not only educating yourself and getting this tsunami of information in, but also parsing it and distributing it and encouraging, and also, tracking people. It's just a lot. So
I was going to say, there's this report out amongst public health, like medical professionals. We supposedly have the best stocked alcohol reserves, because we want to medicate, but we all don't have the time, and then know that we're just going to be more tired the next day. So there's some study out there right now that says, if you want to rate a fridge, my fridge might be one of the best places. It's stocked, it's just not being utilized.
All right. So we have less than a minute, and I would like to just give you guys that time, probably about 45 seconds, to just reiterate again, what we should be doing and the simple practices, just so that we're all encouraging that.
You want to go?
Sure. First and foremost, we should continue to wear a mask whenever we are in a public place. With people that you don't know, try to ignore the 6 feet rule. If you don't know the person 20 feet away from you, put on a mask. but make sure you're washing your hands, not going to high level risk areas, and not so much social distancing. You can see friends, but make sure that you're maintaining that physical distance, that safe physical distance when you do see people, and just have safe interactions. Be smart.
Thank you.
You know the town can.
Thank you. You guys are awesome. And thanks again for the time. I look forward to seeing you next week. See you all next time at Hangout Hour.
Thank you.